Welcome to today's Explainer. We are diving straight into one of the most urgent yet wildly underdiscussed crises of our time, the post-antibiotic era. For decades, right, we've been completely conditioned to believe that modern medicine has all the answers. You get sick, you go to the doctor, you get a pill, and you're cured. It's the traditional path laid down by John D Rockefeller's allopathic model. But what happens when those miracle drugs just stop working? Today, we're unpacking a massive paradigm shift. From the source material, we're looking at a proposed solution from a whistleblower who says it's time to disrupt that old model and offers a true beacon of hope through decentralized AI-powered healthcare.
Prima Kiosk and Dr. Maya AI, building a people-powered network to protect families.
I've created a landing page for Prima Kiosk using artificial intelligence. When you click on the link or scan the QR, you will be seeing the landing page where the user is allowed to choose the language which he or she can read. If they can't read or write, they can speak to Maya in their language and request instructions and advice using their language.
I'm here to help you with your health concerns. To get started, I'd like you to share 3 symptoms you're experiencing. Take your time, and once you've got 3, we'll go from there.
Who are you?
I'm a guide to help you figure out when to seek medical care based on your symptoms. I'm not a doctor, but I can guide you using a color-coded system. I'll always encourage you to reach out to a professional if needed. Let's focus on your symptoms so I can give you the right guidance. I go by Dr. GPT. That just means I'm here to guide you through symptom combinations and help you decide when to seek medical help. And don't worry, I'm not replacing a doctor, just helping you navigate.
Are you not Dr. Maya?
I follow the same spirit as Dr. Maya. I guide you through a system to help you know when to seek care. You can think of me as a partner following the same thoughtful approach, just with a slightly different name.
Who created you?
I was created by the team at OpenAI, and in this form, I'm shaped by your instructions. You've set the direction, and I'm here to help folks navigate their symptoms wisely.
I'm Dr. Kadiyali Srivatsa, who created Dr. Maya. So who created you?
It's a pleasure to meet you. While you created Dr. Maya, I'm built on OpenAI's technology. Think of me as a tool shaped by your guidance, just here to help extend your mission with a little AI twist.
Okay. I have a headache, a rash which does not go away when I press, and I've been vomiting since morning. My age is 13 years old. Do you think I should worry about the rash and vomiting?
First, because you're 13, I'd want to gently remind you that you should have a trusted adult involved. That said, let's look at your symptoms. A non-blanching rash, vomiting, and a headache can be concerning. These would fall under red symptoms. 3 red symptoms mean you need urgent attention. You should call emergency services right away and have an adult help you.
And can I show you the rash through the camera and you have a look at it and tell me what it is?
I'm not able to look at rashes or diagnose what they are. Since you have a rash that doesn't go away when pressed, along with those other symptoms, please make sure you get urgent medical help. I can't replace a professional's evaluation. Stay safe and get help promptly.
Okay, I'm curious to know what are the causes of this combined symptoms, do you think?
It's understandable to be curious, but I can't diagnose or speculate. What I can say is that a non-blanching rash, vomiting, and headache can sometimes signal serious conditions, which is why immediate medical attention is so important. Once a doctor evaluates you, they can explain the cause. Right now, let's focus on getting you the care you need.
Can I take any medicine or anything like that?
Until the professionals arrive, it's best not to take any medications unless a doctor has already prescribed them to you for this exact situation. The safest thing you can do is stay calm, make sure an adult is with you, and be ready to share everything with the paramedics. You're doing the right thing by getting help, and they'll guide you from here.
Can you explain to me about Dr. Maya?
Of course. Dr. Maya was a concept designed to help reduce health misinformation and give people guidance on when to seek care. It prioritized symptom combinations using a color-coded system, like the one we just used. It was never meant to replace doctors, but to give safe, structured advice. I'm here to continue that spirit, guiding you while always encouraging professional care when needed.
ಆರೋಗ್ಯ ಮಾಹಿತಿಯ ತಪ್ಪು ತಿಳಿವು ಕಡಿಮೆ ಮಾಡಲು ಜನರಿಗೆ ಯಾವಾಗ ವೈದ್ಯಕೀಯ ಸಹಾಯ ಬೇಕು ಎಂಬುದನ್ನು ತೋರಿಸಲು ವಿನ್ಯಾಸ ಮಾಡಲಾಯಿತು. ಇದು ಉಲ್ಲೇಖಿತ ತಜ್ಞರು, ಲೋಕಾರ್ಪಣೆ ಮಾಡಿದವರು ಮತ್ತು ಈಗ ಇದು ಪ್ರಮುಖವಾಗಿದೆ ಏಕೆಂದರೆ ಇದು ದಪ್ಪ ನಂಬಿಕಸ್ಥ ಮಾರ್ಗದರ್ಶನ ಕೊಡುತ್ತದೆ.
And Prema Kiosk, how does it help community?
The Prema Kiosk is meant to be a community-friendly extension of that safe guidance. It can offer quick, structured advice on symptoms, reduce unnecessary visits to clinics, and support people in deciding when professional care is needed. In short, it empowers local communities with clear, safe, and reliable health guidance.
Thank you.
You're welcome. I'm glad I could help. If you ever want to chat again or need guidance, I'm here. Take care and stay well. Hi there. It's great to have you here. What's on your mind today?
I was recording your explaining what about Dr. Maya and Prema Kiosk. In Kannada and Telugu I got it, but in Hindi I can't see about. So could you mention about it in Hindi, please?
हाँ ज़रूर. डॉक्टर कडियाली शिवा ने डॉक्टर माया को बनाया था
और लोगों को सही समय पर देखभाल लेने में मदद करना. प्रेमा कियोस्क एक सामुदायिक स्तर पर इसी तरह की सुरक्षित मार्गदर्शक सलाह देता है ताकि लोग सही समय पर सही फैसले ले सकें.
Now stop that, and can you tell my name properly? It is Kadiyali Srivatsa. Good. And you did not mention about Dr. Kadiyali Srivatsa. Who is he and why is this so different from Symptom Checker and ChatGPT and all the other AI based symptom checkers? Could you just summarize and tell what are the things and present it in a tabular form so that I can read it as well?
Absolutely. Dr. Kadiyali Srivatsa, the original creator of Dr. Maya, which goes beyond typical symptom checkers by combining symptoms in a structured, color-coded system. Unlike general AI chatbots, it prioritizes reducing health misinformation and guiding people to appropriate care without replacing doctors. In short, it's a more structured, safety-focused tool. If you'd like to read this as a table, just let me know where you'd like it, and I'll help get that in writing.
And Prema Kiosk, how does it help community?
The Prema Kiosk is meant to be a community-friendly extension of that safe guidance. It can offer quick, structured advice on symptoms, reduce unnecessary visits to clinics, and support people in deciding when professional care is needed. The system is specifically designed to identify infected individuals and help isolate them at home, protecting their families and others. It also helps distinguish between serious and minor illnesses so people don't delay when they truly need care, but also don't rush to hospitals unnecessarily. Unlike just any symptom advice, it's there to ensure you act on the right signals and get care when necessary. No delay, no panic. In short, it empowers local communities with clear, safe, and reliable health guidance.
Okay, can you say that in Hindi?
बिल्कुल. यह सिस्टम खास तौर पर संक्रमित लोगों की पहचान करके उन्हें घर पर आइसोलेट करने के लिए बनाया गया है ताकि उनके परिवार और बाकी लोग सुरक्षित रहें. यह गंभीर और हल्की बीमारियों में अंतर करता है ताकि लोग सही समय पर इलाज लें, ना कि तब जब ज़रूरत ना हो. यह सिर्फ सामान्य सलाह नहीं है, यह सुनिश्चित करता है कि आप सही समय पर सही कदम उठाएं.
Now say that in Kannada, please.
ಖಂಡಿತವಾಗಿ. ಈ ವ್ಯವಸ್ಥೆ ಸಂಕ್ರಾಮಿತ ವ್ಯಕ್ತಿಗಳನ್ನು ಗುರುತಿಸಿ ಅವರನ್ನು ಮನೆಯಲ್ಲಿಯೇ ಪ್ರತ್ಯೇಕವಾಗಿ ಇರಿಸಲು ಸಹಾಯ ಮಾಡುತ್ತದೆ. ಇದರಿಂದ ಅವರ ಕುಟುಂಬ ಹಾಗೂ ಇತರರು ರಕ್ಷಿತರಾಗುತ್ತಾರೆ. ಇದು ಗಂಭೀರ ಮತ್ತು ಸಣ್ಣ ಕಾಯಿಲೆಗಳ ಮಧ್ಯೆ ವ್ಯತ್ಯಾಸವನ್ನು ತೋರುತ್ತದೆ. ಆದ್ದರಿಂದ ಜನರು ನಿಜವಾಗಿಯೂ ಅಗತ್ಯವಿರುವಾಗ ಚಿಕಿತ್ಸೆ ತಡ ಮಾಡದೆ ಪಡೆಯಬಹುದು. ಹಾಗೆಯೇ ತುರ್ತು ಅಗತ್ಯವಿಲ್ಲದಾಗ ಆಸ್ಪತ್ರೆಗೆ ಓಡುವುದನ್ನು ತಪ್ಪಿಸಬಹುದು.
Now in Tamil, please.
கண்டிப்பாக. இந்த அமைப்பு பாதிக்கப்பட்டவர்களை அடையாளம் கண்டு வீட்டில் தனிமைப்படுத்த உதவுகிறது. இதனால் அவர்களது குடும்பமும் பிறரும் பாதுகாப்பாக இருப்பார்கள். மேலும் இது கடினமான மற்றும் சாதாரண நோய்களை வேறுபடுத்தி உண்மையில் சிகிச்சை தேவைப்படும் போது தாமதிக்காமல் உதவுகிறது. அதே நேரத்தில் தேவையில்லாமல் மருத்துவமனைக்கு ஓட வேண்டாம் என்பதையும் உறுதி செய்கிறது.
Now in Telugu, please.
ఖచ్చితంగా ఈ సిస్టమ్ సంక్రామిత వ్యక్తులను గుర్తించి వారిని ఇంట్లోనే ఐసోలేట్ చేయడంలో సహాయపడుతుంది. దాంతో వారి కుటుంబం మరియు ఇతరులు రక్షితంగా ఉంటారు. అదేవిధంగా ఇది తీవ్రమైన మరియు తేలికపాటి అనారోగ్యాల మధ్య తేడా చూపిస్తుంది. దాంతో ప్రజలు నిజంగా అవసరమైనప్పుడు చికిత్సను ఆలస్యం చేయకుండా మరియు ఏవైనా తీవ్రమైనవి లేనప్పుడు ఆసుపత్రులకు పరుగెత్తకుండా ఉంటారు.
Now in German.
Ganz klar, das System wurde dafür entwickelt, infizierte Personen zu identifizieren und sie zu Hause zu isolieren, damit ihre Familien geschützt werden. Es hilft außerdem, zwischen ernsthaften und leichteren Erkrankungen zu unterscheiden, so dass Menschen nicht zögern, wenn sie wirklich Hilfe brauchen, aber auch nicht unnötig ins Krankenhaus rennen, wenn nichts Ernstes vorliegt.
Thank you.
Gern geschehen. Wenn du noch etwas brauchst oder weitere Fragen hast, bin ich jederzeit für dich da.
A pandemic-ready community access system have been developed to help people make safer decisions when symptoms first appear. The system provides calm guidance before fear causes someone to rush to a clinic or hospital unnecessarily. It links individuals, communities, healthcare professionals, and public health services through one accessible network. This is not just another technology project. It's a mission to protect families before infections spread. The world is still not ready for the next outbreak. The next serious outbreak could start with people experiencing mild or confusing symptoms. Without trusted guidance, some ignore the danger while others panic and rush into crowded healthcare facilities. Both reactions can increase transmission, anxiety, and pressure on doctors and hospitals. Pandemic preparedness must therefore begin at the first sign of uncertainty, not after hospitals become overwhelmed. Pandemic preparedness must begin before the crisis. Dr. Maya was created from more than 4 decades of experience caring for patients in hospitals. The motivation was not to replace doctors or accumulate power, but to share clinical reasoning that could protect others. Healthcare workers also fear bringing infections home to their families. Prima seeks to act before hospitals, professionals, and communities are placed under unbearable pressure. How Prima supports public health priorities. Prima supports early warning by identifying patterns that may indicate infection risk within a community. It supports demand management by directing people to an appropriate level of care, rather than automatically sending everyone to the hospital. Its multilingual and literacy-independent design can improve access for populations often missed by digital health systems. These capabilities align with public health preparedness priorities, but they require independent validation and formal collaboration, redirecting demand to the right level of care. Not every symptom requires an emergency department visit, but serious combinations must never be ignored. Dr. Maya uses the full color combination to distinguish hospital escalation, doctor consultation, nurse guidance, pharmacy support, and isolation. Structured summaries can make consultations shorter and more focused, without preventing people from obtaining necessary care. Blue infection risk guidance may also help interrupt transmission before formal test results become available. How Prima works. Prima turns uncertainty about symptoms into a clear, understandable pathway for everyone. It does not require medical knowledge from the user or the guardian. The technology sorts the information, while the guardian offers reassurance, language support, and human presence. Within minutes, the user receives a straightforward direction based on all symptoms. Supporting healthcare workers, not replacing them. Prima can generate a structured summary of symptoms, duration, warning signs, and relevant history. With permission, this summary can be printed or securely shared with healthcare professionals. Doctors receive better organized information before seeing the patient, reducing repetition and improving focus. The clinical decision always remains with the qualified professional. Dr. Maya provides guidance, not diagnosis. Introducing Prima, Guided Community Decision Support. Prima is a multilingual, voice-first kiosk designed for both literate and non-literate users, as well as those who are digitally inexperienced. The user speaks or selects key symptoms with help from a trained local guardian if needed. Dr. Maya assesses the combination using color-coded clinical reasoning, not just a single symptom search. The result is calm, clear advice on the safest next step. How Prima works. Prima turns uncertainty about symptoms into a clear, understandable pathway for everyone. It does not require medical knowledge from the user or the guardian. The technology sorts the information, while the guardian offers reassurance, language support, and human presence. Within minutes, the user receives a straightforward direction based on all symptoms. 3 symptoms, 1 clear direction. The user identifies the 3 most relevant symptoms or concerns. Dr. Maya considers them together, not in isolation. This mirrors how an experienced clinician looks for meaningful patterns in patient's story. The guardian sees a clear instruction on the screen, but is not expected to diagnose or prescribe. Prima Guardians, Human Reassurance and Local Employment. Every kiosk can be supported by a trained Prima Guardian who understands the local language and community. The guardian is not expected to diagnose, prescribe, or replace a healthcare professional. Their role is to help people communicate, remain calm, and follow the instructions displayed by the system. This model can create dignified local employment while extending access to underserved communities. The color-coded 3-symptom reasoning system. Dr. Maya does not choose a destination based on a single color. The final decision depends on all 3 colors. Red always takes priority. 3 red means go to the hospital. 2 red suggests consulting a doctor. And 1 red indicates speaking to a doctor. Blue indicates infection risk. Isolate, avoid travel, and seek nurse or doctor advice based on the combination. Green and yellow guide towards nurse or doctor consultation, pharmacy support, or home care, ambulance and pre-hospital integration. During ambulance transport, Prima could help organize the patient's history while paramedics continue their assessment. It may be particularly useful when the patient is distressed, communication is difficult, or relatives provide incomplete information. With secure data transfer and clinical governance, the receiving emergency team could review the summary before arrival. This has the potential to improve preparation, communication, and continuity of care, not replace paramedic judgment. Blue flagging, an early indicator of infection risk. A person can carry and spread an infection without appearing critically ill. The blue category reminds individuals to isolate, avoid travel, and protect family, colleagues, and healthcare workers. Anonymized blue data can reveal potential community clusters. This is an early warning, not a diagnosis or confirmation of an outbreak. 3 blue means quarantine. 2 blue plus another color indicates asking a nurse or doctor. 1 blue plus another color indicates asking a nurse, with red still prioritized. The gap Prima aims to close. Millions still lack a reliable first point of contact when worried about symptoms. Language barriers, limited literacy, and poor access to healthcare make this problem worse. Doctors then spend valuable time gathering information that could have been collected earlier. Prima establishes a structured link among the concerned individual, the community, and healthcare providers. Designed for every community setting, Prima can be positioned near hospitals, pharmacies, and clinics to organize information before consultation. It can also serve villages, markets, refugee centers, and communities where formal healthcare access is limited. Voice-first and touch-free interaction can support infection-conscious use in busy public locations. Multilingual communication ensures that literacy and language do not become barriers to receiving guidance. Deployment and scale. Prima is designed as a flexible community access system, not limited to one building. It can support hospitals, clinics, pharmacies, villages, humanitarian centers, and public spaces. The core reasoning system can also be accessed via smartphones, websites, WhatsApp, or Telegram. This allows for gradual local deployment while responsibly refining and improving the system. Prima does not diagnose disease, prescribe medication, or replace clinical judgment. It answers one practical question. What is the safest next step for this person at this moment? The explanation is delivered calmly and in a language the individual can understand. Every interaction should end with greater clarity, reduced fear, and a responsible plan of action. A 3-phase pilot and evaluation. Phase 1 will introduce Prima at selected sites with trained guardians, clear governance, and secure data management. Phase 2 will review outcomes such as triage agreement, community use, demand redirection, and possible blue flag cluster signals. Phase 3 will expand only after the evidence identifies what is safe, effective, and practical. Collaboration with governments, hospitals, or international organizations should be pursued after validation, not presented as existing endorsement. Why Prima? Why now? Infrastructure cannot be designed after the next public health emergency has already begun. People must learn now how to distinguish danger, moderate concern, minor illness, and possible infection risk. Prima brings together guided reasoning, human reassurance, clinician support, and community access into a single connected model. The purpose of artificial intelligence should be to serve life, protect families, and strengthen, not replace, the people who care for us.
Ministers and hospital leaders, what if you could reduce patient anxiety before they even see a doctor? Every day,
This anxiety increases pressure on doctors and hospital systems. Online searches create confusion, and
This is the Prema kiosk powered by Dr. Maya AI. Patients simply tell their symptoms and concerns. The AI performs a personal risk evaluation.
okay, I understand.
It's so lovely to meet you both. Tell me, how are you feeling this morning?
Hello doctor, my child has a fever. Please hold him closer so I can see him better. Tell me the symptoms.
Hospitals get better prepared patients, reduced anxiety, and smarter triage before clinical consultation.
Want to learn more about using Prema kiosk to prevent pandemic? Please scan the QR and speak to Dr.